This conference will now be recorded.
So good evening, everyone.
Good evening, sir.
Yeah, good evening. I think Anuradha, she's not connected, having some issue, I think. Check your... Okay. So today we have to discuss chapter 8, guys, right? It's a laboratory and pathology. So before that, just we have to revise the yesterday one. So yesterday we are discussing some of the procedure in chapter 6, as well as some of the theoretical questions we are discussing, right? What is this technique? Which laboratory it is performed? And then what is the purpose? What is cryopreservation? So, guys, before your exam, please prepare this theory part, because this theory part is very important in your exam. So they have to ask this question in your chapter 8 question. Okay, so today we have to discuss the coding part. So yesterday I'm already informed, chapter 8 also one of the easiest topic only, but all the topic in this chapter 8, it's a direct leading questions only, right? We don't have any major concepts or guideline. But one thing don't forget, we have one topic, guys. The topic is called as panel coding, right? In this panel coding, we have to apply some concept and guideline. If you apply that method, then only you are getting answer. So overall in your CPT book, we have only two topics we need to apply the concept to get the answer. So in that line, the first one we have in this panel coding, and another one is the Mohs surgery in chapter 1. So these two only we have the concept oriented. So remaining all the other topic is a guideline different. But the concept, if you apply something, then only you are getting answer. So this type of scenario. So first we have to discuss that panel coding. After that, the remaining topics we have to discuss one by one. So please note down the heading panel coding, guys. Please note down the heading panel coding. Okay, first we need to discuss what is panel coding, right? So I hope you guys, everyone is a hospital oriented candidate, right? So you guys definitely working in hospital, or else maybe in our lifetime we go with any hospital. It's a common, right? Okay, so why I'm asking me, if you go with any hospital, the hospital having some lab sheet. I hope you guys remember that, right? The hospital having the lab sheet. So whatever the lab test they have to perform, all those tests they have to mention in that particular lab sheet. So for example, whenever the patient directly meet the doctor, that time the provider will be tick mark the things. For example, RBC or WBC, platelet count, like that. Whatever the provider will be tick. So based on the scenario, based on the service, the laboratory they have to perform the service. Same likewise, if you guys seen that, mean in that lab sheet we have one test is called as complete blood count, right? If you're having any fever or any infection or diarrhea, vomiting, whatever, nowadays first the product will be order, okay, you will do CBC, like that. CBC mean complete blood count. So if the product will be mark CBC, in lab the multiple test will be included. For example, CBC is marked mean the product will do, in lab they are doing RBC, WBC, platelet, erythrocyte, like that. All the tests they are done. So that this is called as panel coding, guide. So one panel, if the product is marked, mean in that panel the multiple tests will be included. So this is called as panel coding. For your knowledge, the best example is the complete blood count. The complete blood count mean it's one of the panel. If the product mark that panel mean the multiple test will be doing in your hospital. So this is called as panel coding. Okay, please note down the code sets, guys. 80047, 80047 hyphen 80047 hyphen 80076. 80047 hyphen 80076. So this is for panel coding code sets, right? 80047 to 80076. So these are all the panel coding code sets. Okay. You guys please go to that codes and check what is the code for comprehensive metabolic panel, guys. Just to go and check and send me the answer, guys. What is the code for comprehensive metabolic panel?
So 80053.
Yes. So 80053, right? Okay. And then what is the code for renal function panel, guys? Okay, super. Then what is the code for hepatic function panel?
80076.
Okay. Right? Okay. So this is the panel coding, guys. So whatever the panel codes they documented, so we have to code, right? Okay. So if the panel directly the provider is given, you have to code accordingly. So that's not the issue. In case the two panel, if the single panel they given mean, you directly code accordingly. But in case the provider documented two panel, we have to follow one guideline. So what does a guideline mean? Please note down, guys, the two panel we don't code together. The two panel we don't code together. Right? The two panel we don't code together. Guys, this is a guideline, guys. So please note down this. Okay. So now we have one confusion. So what does that mean? What does that mean? If the provider documented single panel mean, we have to code easily. But in case two panel the provider is documented, we have to follow one guideline. The guideline is the two panel we don't code together. Okay. So now what we do? So now I will give you some of the key point. If you guys follow this key point, you guys easily understand and easily get the answer in this panel coding. So we have to discuss one by one. The first one is okay, I will give you one question and also I will teach you how to do the panel coding. So this thing I want to discuss. So before that, please note down, guys. Please note down. The question is MD order comprehensive metabolic panel and also basic metabolic panel calcium ionized. Right? Again, I repeat. Again, I repeat. The provider order basic metabolic panel calcium ionized along with comprehensive metabolic panel. So this is your question. So now we already know as per the guideline, the two panel we don't code together, right? So if you apply something, you are getting answer. So we have to discuss that key point one by one. So first key point is what you guys will do mean you have to check the two panel code. You guys tell me what is the code for basic metabolic panel calcium ionizer, guys?
80047.
Yes, 80047. And what is the code for comprehensive metabolic panel?
80053.
Yes, 80053. Okay, so you guys note down that. The first step, always remember, whenever you have to code panel coding, your first step is you have to check what is the panel code they given. So the panel code you have to check. And second step, you guys will check in these two panel, which panel is having minimal test and which panel having more test, guys. Right? You guys check and tell me. So which panel below that we have minimal test and which panel below that we have more test.
Comprehensive has more.
Yes. So if you check this mean the comprehensive having more and then basic metabolic panel having minimal. Okay. Now the third step, guys. First step you have to check two panel code, and the second step you have to check in these two panel code which panel having minimal test and which panel having more test. So this is the second step. And the third step is the minimum to high you have to cross check, guys. Again I repeat, minimum to high you have to cross check, which mean in minimal like 80047 whatever test is there, you just check the same test is given or not in 80053. So you have to check one by one. Okay, we will do. For example, 80047 having minimal test. So one by one we have to check. The first test, calcium ionized. Guys, please check whether the calcium ionized is given or not in 80053.
No, sir. Calcium total is given.
So 8 double like calcium minus is not given, right? Okay, so you guys please note down the code 82330 separately, right? And next one, carbon dioxide bicarbonate is given or not, guys?
Given.
Given, sir.
Yes, given. Okay, just leave that. Then chlorate creatinine glucose is given or not?
Given.
Yes, is given. And then potassium is given or not?
Given.
Okay. And then sodium urea nitrogen is given or not?
Yeah. Only sodium.
Okay. So except calcium ionized, remaining all the test already is given in 80053. Now your answer is this missing code 82330 along with you have to use that comprehensive metabolic panel 80053 you have to use. That's all, guys. The answer is this one. So your answer is 80053 comma 82330. That's all, guys. This is panel coding. So three steps you need to follow. First step, you have to check the two panel code. Second step, you have to check which panel is minimal, which panel is more. The third one is the minimum to high you have to cross check. But I will give you one hint, guys. What does that mean? Maximum in your answer, the 80053 will come. Additionally, any test is missing, that time that only you have to code separately, because comparing to all the panel, the 80053 having more tests. So definitely it will come answer. So remaining, if anything is missing, mean you code separately. That's all, guys. So this is for panel coding. Clear? So this is the guideline and this is the format. But whenever we have to teach, that time you guys clear on this. But whenever you have to practice, then only you have to learn. So I will give one homework question, guys. Please note down. Right? The question, please note down. MD order. MD order. MD order. Comprehensive metabolic panel. MD order. Comprehensive metabolic panel. MD order. Comprehensive metabolic panel. with renal function panel. MD order comprehensive metabolic panel with renal function panel. So this is a homework question, guys. After this session, you guys check and you have to code this one. Clear? That's all. So this is for panel coding. You guys are receiving one question from this. And next one is a drug testing, guys. So drug testing mean the patient, the provider will be ordered some medicine, right? Because of that medicine, the patient getting some side effects. So the provider given the result. So how they are given the result? Based on that, the drug testing codes will be given. So we have three codes, guys: 80305, 306, and 307. So 305 mean the drug testing, the provider given the result via direct optical observation, right? The provider given the result via direct optical observation. So that time we have to use the code 80305. So direct optical observation. So you guys know, right? Direct optical observation, nothing but, guys. For example, the pregnancy card. What happened if the patient also easily they are getting whether this is positive or negative like that. So same likewise, some of the kit is there. So the provider will be directly checking and give the result via optical observation. So this is for 80305. And the 306 is for instrument assisted. The provider given the result via microscopic examination. That time you have to use the code 306. And the 307 mean they given the result via chemistry analyzer. So the chemistry analyzer, this question you are receiving in your exam, right? 80307, the chemistry analyzer you are receiving in your exam. So please note down this and please put important symbol on 80307 code, guys. But this is a direct leading. Hereafter, whatever we're discussing, everything is a direct coding only, guys. So please note down this, guys. So once you guys note down, please update.
Completed, sir.
Completed.
Okay, I hope you guys are completed. So this is, sorry, this one is not. Yeah, so please note down GTT, guys. Next one.
Completed, sir.
Completed. Completed.
So the next topic, what we have to discuss mean, this is for GTT, guys. Right? So GTT mean, you guys please note down, glucose tolerant test. The GTT mean glucose tolerant test. So this is a test. This is a test for confirmative test for gestational diabetes, guys. Right? This is a test for confirmative test for gestational diabetes. Okay, what is the special in this particular GTT mean? Normally, if the product perform any service mean, right? Normally, they have to given any test. If we are going for any test mean, what happened? The one time or two time the specimen they have to collect it. But in this GTT, minimum 3 time, maximum 6 to 7 time they are taken the specimen, guys. So based on the specimen only, we have the codes. So 82951, this is for first 3 specimen, right? So the 82951, this is for GTT for first 3 specimen, and then 82952, this is for beyond 3 specimen, right? So again I repeat, The GTT first 3 specimen mean we have to use 82951, and beyond 3 specimen mean 82952. So this is the concept, right? Okay. For example, and one more thing, guys, please note down the 82952 is the add-on code, guys. 82952 is the add-on code. Okay, so please note down the question, guys. The question is, the provider order GTT 5 specimen. The provider order GTT 5 specimen, right? So how to code this, guys? So GTT 5 specimen mean how to code? What is the answer? Any idea?
Sir, 82951 into 2.
Yes. So the answer is 82951, comma 82952 into 2 is the answer. That's all, guys. So this is for GTT. And one more thing, please note down. We don't use 91 modifier. We don't use right. So we don't use 91 modifier along with GTT code. Clear? That's all, guys. So this is for GTT. So panel coding, GTT, and then drug testing. And next one, you guys please note down urine analysis, guys. Once you guys note down this, please update me.
Completed.
Completed, sir.
Completed.
Okay, guys. So the topic is urine analysis. So urine analysis, we have two different type. Actually, urine analysis is a common service, guys. Like if you have any fever or any problem, the provider what they are doing mean, right? So what they are doing mean, they have to collect the urine sample, right? So they have to collect. So the urine analysis, the provider perform via two different method. One is the automated method, another one is the non-automated method. Automated mean directly in machine they have to do. So non-automated mean the provider what they are doing mean they have to do the process in manual, right? So this is a two different thing. So in this scenario, sometimes the provider perform with the microscope or without microscope. So based on this, so actually in your exam, if the provider documented directly, if the provider perform automated or non-automated, whatever, so that directly we have to code. So we don't have issue. So you guys tell me, in case the provider documented, I am performing urine analysis. That's all. You guys clear? The provider documented, I am performing urine analysis. That's all. Now, what code you have to use as a default?
So 81002.
So this is code. Yes. So please note down, guys. This is a question we are receiving. If the provider did not documented anything, only they order urine analysis. That's all mean. You have to use the code 81002. That's all. So this is the answer we have to use. Clear? That's all. So this is for urine analysis. And the last one is the surgical pathology, guys. So please note down, the last one is the surgical pathology. So surgical pathology also, it's a very easiest topic, guys. Please note down the code sets, guys. Please note down the code sets. Right? Please note down the topic. So first thing, you guys please go to the code sets, guys. 883022 309. Double 83022 309. Okay. So if you check that code sets mean, each code they documented. Each code they documented. For example, they documented as level 1, level 2, level 3, level 4. Like that they document. So each code below that, the sample they given. Actually, what is surgical pathology mean? If the provider doing any location biopsy mean, we have the code separately, guys, right? For example, cecum biopsy, or else if the provider documented any tumor biopsy mean, you have the codes for that particular topics. But in these surgical pathology mean, what we have to base it mean, whatever the sample they send. So based on the sample we have to code. This is for surgical pathology. Okay, very simple. All this surgical pathology code below that they given some sample. Whatever the sample they documented, you have to code accordingly. For example, you guys check and tell me which code below that myocardium biopsy will come. You guys please check and tell me myocardium biopsy comes under which code, guys?
Sir, 88307.
Okay, so 88307. Okay. Okay, which code below that testis tumor will come?
88309.
Okay, 88309. Okay, and then which code below that nerve biopsy will come?
Double eight
Double
three
eight
zero
three
five.
zero five.
So 88305. That's all, guys. So whatever the code below that the sample will come, you have to code accordingly. That's all. Clear? Okay. Now the last question. This is the exam question. You guys check and tell me which code below that uterus lesion will come. You guys check and tell me the answer.
Sir, 88309.
Okay. Okay. So if the provider documented uterus lesion. So uterus mean the three codes we have the uterus lesion. One is 305 we have, 307 we have, 309 we have.
Yeah.
In 305, what documentation they given, guys, for uterus lesion? What documentation we have? So for the uterus, in 305, what description they given, guys, in uterus?
Sir, uterus with or without tubes and ovaries for propulsive.
So
Prolapsing.
for prolapse they given, right?
Yeah.
So 305 they given as prolapse. Okay. In 309, what they given, guys?
Uterus with or without tubes and
Uterus
ovaries
with or without
neoplastic.
ovaries, other than neoplastic or prolapse.
Yes. So they given as the neoplasm. Now 307, what they given?
Uterus with or without tubes and ovaries other than neoplasm and prolapse.
Yes. So this is the answer, guys. Whenever other than neoplasm or other than prolapse, that time we have to use 307. So lesion is not a prolapse, it's not a neoplasm. So we have to go for other than. That's all, guys. That's all about surgical pathology. So very easy. Whatever the documentation they given, based on that you have to code. That's all, guys. So surgical pathology, GTT, drug testing, urine analysis, panel coding, and theory questions. You have to prepare all this, so you guys are getting questions from in this particular topic. So that's all about chapter 8, guys. So tomorrow we have to discuss chapter 9. So still we have one topic remaining, guys. If we completed chapter 9, the minor topics will end. So next we have to enter into the major topic, right? So please plan accordingly. So that's all, guys. So thank you, everyone. See you tomorrow, guys. Bye, everyone.
Thank you, sir.
Thank you.